This is an educational video for healthcare professionals on how to do very basic cheek augmentation procedures. I'll be taking you through how to analyze the areas, which are the risk areas, and then followed by some suggested injection techniques. Remembering that there are various different injection techniques and various different approaches, so this is really meant for a beginner doctor starting off with cheek augmentation procedures. Hope you find it helpful. Okay, so let's first look at the analysis of the cheek. So we can draw the Hinder's line to divide the cheek into the anterior medial, then the malar eminence, the mid-cheek basically, and then the lateral cheek. And these different regions can be analyzed with either the Hinder or the Powell's analysis or the Schoonrock analysis. So this is just to get your eye into looking at the different areas which you want to enhance, because not all patients would actually need enhancement of these areas. We can either go for a needle technique or we can go for a cannula technique. Needle is typically boluses and cannula would be more fanning technique. Now remember, the facial zone area is really not safe at all. So we have the very dangerous zones, which is the medial cheek area over the facial artery, over the temples, around the eyes, but it doesn't mean that there's really a safe zone. So this is why cannulas is rather suggested for all types of filler augmentation procedures. So let's start with the needle technique. So this demonstrates the anterior medial technique, where we first aspirate, really make sure that you're not inside a blood vessel. And then after a negative aspiration, we do a bolus technique of injection, where we inject, but at all times we are watching the skin perfusion. We are checking the area to see if there's any problems that we see with capillary refill. Now we're moving over to the malar eminence area. Also again, first aspiration and then only start injecting in a bolus technique, checking the skin all the time. You can obviously move to other areas to retouch it again, especially if you see, and especially at the end after checking symmetry, to like retouch an area. But then again, as soon as you move your needle, aspirate before you inject. So this is the medial and then the malar eminence. Then the lateral cheek augmentation or the zygomatic prominence is really seen as giving that lifting technique. A relatively safer area because it's on the zygomatic arch, but we can also get some arteries there, the zygomatic facial artery, some branches of it. We always get some abnormal anatomy in patients, so always be careful. Then we move on to the cannula technique. Now, cannula technique is so much more safer. So we use a 22 gauge cannula of either 50 or 70 millimeters. And with one entry point and a blunt cannula, now we can move to lateral, we can go to medial, to the most anterior medial cheek zone areas. You can make a different entry point. You can go more lateral lifting technique of the lateral zygomatic. You can even move to the temples. So with cannula, you have so much more control of which area you are. You have so much more safety when doing the cannula technique. I think the most important to remember is to do a good marking of the patient. Remember to know your anatomy before you start with these procedures. Use the correct product at the right depth. And always remember to look at the vascular supply. Whether you are using a needle or a cannula, look at the capillary refill, look at your patient, look for any danger signs such as sudden pain, sudden pallor of the area, marble type of an effect, reduced capillary refill. Always look for those signs whenever you do any type of augmentation procedures with fillers, because the last thing that you want to do is to have the product end up into the vascular system and have a necrosis or even more disastrous types of problems. So good analysis of the patient, do it in the right area according to the patient, respect the natural artistic proportions of the face, respect the natural anatomy of the patient, and always remember there can be abnormal anatomy, especially in the vascular supply. I hope this will help you to give a very quick review of what is cheek augmentation procedures, and preferably, as I said, go with the cannula technique. A 22 gauge cannula is so much safer and you have so much more security and you can actually feel the layers. Good luck with your cheek augmentation procedures.